Welcome back to another episode of the Benefits Insider. I'm Chris Hamilton, your host. Today, we're going to cover everybody's most favorite time of the year, which is insurance open enrollment.
What did I do? I did my job. I slashed benefits to the bone. I saved this company money. Was I too harsh? Maybe. I don't believe in coddling people.
Who are we kidding? This is everybody's least favorite time of year. Why? Because insurance is expensive, the cost goes up, it's confusing as hell. And how do you pick the plan that's right for you or your family? We're going to solve that today. Over the next few minutes, I'm going to walk through plan designs, costs, and some scenarios to help you figure out what's the right insurance plan for you and your family.
Benefits Insider.
I'll start off by saying these are going to be really common plan designs. This is not if you're not a client of mine using the Benefits Insider approach, or you don't work for one of my clients using our approach, you don't have access to a ton of creative options. So these are going to be really standard plan designs. This is really a conversation focused around the type of designs that we see a lot of employers using, but this math and the logic will work on the individual marketplace as well. If you follow the logic, the maths out, and you can apply this to an individual policy or a group policy. Either way, the math works. It's really more the logic that we're going for in doing this. So we'll look here. A lot of employers, mid-sized employers, are going to offer 2 or 3 plans. We went with a 3-plan design here. This is just a summary. I tried to make this really simple. This took 5 minutes to put this together to give you an example of what this looks like. But you'll notice here, there's 3 plans. There's a buy-up plan that has copays, a base plan that has copays, and then a standard, pretty common HSA plan that we see a lot of mid-sized employers offering. What you'll notice here on the base and the buy-up plan, there's a deductible, there's standard co-insurance, and then there's this max out-of-pocket line here. And then there's copays for most everything that you'd use on a day-to-day basis, whether you're going for an office visit for general or PCP, specialist, urgent care, and then medications. What you'll notice on the HSA plan, though, is that there's no copays for anything. It's all deductible and co-insurance. So really the way this works is when you go into a doctor or a pharmacy or a hospital, you're going to meet that minimum deductible at the start. That's $3,500. You'll cost share with the insurance company. They'll pay 80% of your bill. You'll pay 20% until you've spent an additional $1,500 or a total of $5,000 max out of pocket as an individual. And I'm going to look at these plans just as an individual. You can, if you're enrolling a family, you can do the math there, but just for simplicity's sake, we're just going to cover this as if we're talking about an individual. The number one thing people are going to typically look at is they're going to look at the monthly premium. So you can see down here in the middle, there's a $100 employee-only monthly rate. Now, that's not the cost of insurance. A plan like this might run $500 or $600, but the employer is kicking in money to make it a little bit more affordable for the employee. The same is true for the base plan and the buy-up plan. So when you first look at this, the HSA plan and that base copay plan have the same monthly premium for an employee of $100. And you think, oh, why would that be? Well, there's a number of reasons, but there's also something here for the HSA plan. The employer is kicking in an employer contribution of $50 per month. And that's money they're depositing into that HSA account. So when you buy an HSA compatible plan, it's a high deductible plan with no copays. You're eligible for a tax-deferred HSA account. Now, I'm not going to get into all the benefits of that today. It's a really cool plan. I personally have used one since 2009 and love it, but I don't think they're the right plan for most of America, and we'll get into why. But you can see that the employer is kicking in $600 a year to an employee that enrolls in this plan. And there's a number of reasons why employers do this. Puts money into your pocket, helps reduce your out-of-pocket costs. It gives you money when you need to go see a doctor or you need a procedure done. And I'll just kind of hit on why I don't think HSAs, just from the start, why they're not right for most people. A lot of times people are buying the HSA plan because it's usually one of, if not the cheapest plans that are available, offered by an employer. But the problem is if somebody's not willing to put money aside and save money, there's usually sticker shock when somebody walks into a doctor and you're charged, $150, $200, $250 for a visit, or you go pick up a prescription. And because people don't set that money aside, even though they're saving money on a premium basis on every month out of their paycheck, it's the sticker shock when they walk in to use healthcare services. And that often causes people to forego care or avoid care and essentially makes them functionally uninsured. So for a lot of reasons, those are a handful of those. I don't know that this plan fits most people. Now, if you're willing to set aside, if you fall into a couple of buckets, if you don't expect to use insurance much, you're young, you're healthy, or you've got a bunch of disposable income and price isn't usually an issue for you, HSA is probably maybe a good fit. I say maybe. Um, but you've got to be willing to set that money aside to spend it when you need healthcare. So that's kind of my HSA rant for a minute. But you'll notice here on the far left side of the page, monthly premium for the buyout plan is considerably more expensive. The coverage is richer. So if you look up at the top, it's got a much lower deductible and lower out-of-pocket cost than either of the other two plans. This plan is going to be much more expensive on a total premium basis, and therefore the employer is charging more for it. So if you just look at the cost annually, for the buyout plan, it's $3,000. For the base plan, it's $1,200. And for the HSA plan, it's also $1,200. Now, let's talk through a couple of scenarios here. How does this actually work in practice? And I think this is where the math meets the proverbial math, the rubber meets the road. Scenario one, we're going to use Emily as an example. I've used Emily because we've been going through open enrollment meetings, and I've had this scenario pop up. These three scenarios have actually popped up, which really illustrated to me, and I think it's helpful to think about this as users of healthcare. So the insurance is just something that we buy, we pay for it. You're either paying $3,000, $1,200, or $1,200 annually for any of these three plans. That's just the cost of entry to have insurance when you need healthcare. But we actually got out-of-pocket costs. Remember the co-pays, deductibles, and out-of-pocket costs. So let's walk through three scenarios with Emily to see what does this actually look like using healthcare from a budgetary standpoint. So scenario one, Emily, she's pretty healthy. She's young. She doesn't anticipate many medical needs this year, but she does take birth control monthly, and she says she usually gets the flu, once or twice a year. So what does this look like on each of the three plans? Well, remember, she's paying a premium for all three of these plans. So it's either $3,000 or $1,200. When she goes in to pick up her birth control, because that's an ACA preventative medication, but on all three of these plans, it's going to be covered at 100%, which means she doesn't have any out-of-pocket cost. Now, there's some limitations to that, depending on the specific type of birth control you're taking, but generally, it's not going to cost you anything for the medication. Her preventative checkups, so going in for her well woman exam, if you're a male, you're going in for your annual checkup, taking children in for a well visit, not going to have a cost for that if you're seeking in-network care. But her urgent care visits, she's got co-pays for those. And you can see that here. She's got a copay of $50 on the buyout plan, $60 on the base plan, and $200 on the HSA plan. So remember this, when you're using an HSA plan, it's more expensive than using a copay plan because you're paying the actual negotiated rate that the insurance company that you're using has negotiated with that provider. Urgent care visits are going to range anywhere from $150 to $300. I just used $200 for this example just to give you an idea what it looks like. Now, when we look through the medication, so she's maybe getting a Tamiflu or she's getting some other medication to treat her flu. There's several of them out there. I'm just using average costs here. But her prescription, because she's got a copay on the base and the buyout plan, is $50. But and remember, she's got to pay the full cost of the medication on the HSA plan. It's actually more expensive. So that episode of care is going to be $370 to go into the urgent care and to pick up her medication, where if you look at the other two plans, it's either $100 or $110. So it's more expensive to be on the HSA out of pocket when she goes to get that care. But where does the rubber meet the road? It's the total cost. What did Emily pay for not only her insurance, but her out-of-pocket costs when she got the care? And you look at the totals here at the bottom, the most expensive plan is that buy-up. She ended up buying more insurance than she needed. She paid for it. It was $3,100 versus $1,310 on the base plan, or $970. And that $970 is taking into account the $600 that her employer gave her into her HSA account to be used for out-of-pocket costs on the medical plan. So essentially, her employer paid enough to cover all of her out-of-pocket costs and then some. So her net total cost for insurance and healthcare under this scenario is $970. It's the cheapest plan. You think, oh, great, that's awesome. And it is. HSAs work in this scenario. But let's move on to scenario two. So in scenario two, her birth control doesn't work. That's what she told her husband. But she's now 3 months pregnant. I mean, congratulations, Emily. This is awesome. She's going to deliver her baby this year, and just a normal birth at the hospital that is in her area is about $14,000 total cost. And she's still going to expect that she might get sick once this year. So how does this scenario look? Well, you go back through the same math. She's got the cost of her insurance plan. It's either 3,000 or 1,200 bucks. She's going to have the urgent care visit, so 50, 60, or she's going to pay the 200. The same for the medications. But now, when she goes in to have the baby, she's going to have to pay her deductible on all three of these plans. And then she's also going to have the coinsurance, which is going to get her to her maximum out of pocket. Now, when you look at this example, some of this is timing based. So I'm just assuming she got sick early in the year and then had her baby. But you'll notice she's got her $1,500 deductible on the base plan and $2,400 of additional coinsurance. Now, that coinsurance really should be $2,500, but her copays for urgent care and her prescription actually go to her max out of pocket. So it's a total of $2,500 out of her pocket this year. So she's going to spend a total of $7,000 for insurance and her out of pocket costs to go to the doctor, get her prescription, and to have her baby. You can do the math on the base plan. It's actually more expensive on the base plan this year because she's got a much higher maximum out of pocket. She got a much higher deductible and out of pocket. So her total cost would be $7,200. But look at the HSA. It's actually a lot less expensive. She's got her annual premium, the cost for the urgent care and her prescription. She has the $3,500 deductible plus the remaining amount to get to her maximum out of pocket. But she's got that $600 annual contribution from her employer into her HSA account. So she's only spending $5,600 for the total year. So the HSA plan wins out again this year. And so your next question probably is, well, Chris, seems like the HSA plan works out every single time. Not so fast. There's actually the most common scenario that we see is somebody taking medications. And let's walk through that actually right now. That's actually scenario number 3. Poor Emily. She's been recently diagnosed with an autoimmune condition. She needs to take a brand name specialty medication. Now, I've listed a few of them here. There's a bazillion of them out there, and they're expensive. So let's just see how this works on each of these 3 plans. Same scenarios as above. I won't go through all of these line items. As far as the annual cost of the insurance, her urgent care visit, her specialist visit. So you can see those here. But the big cost differential is all of the copays that she's going to pay. Because remember, when we go up here to her plan design, for specialty medication, she has a $250 copay or a $300 copay. Now, I'll mind you, you might think to yourself, wow, that seems like a really high copay. But if you look at some of these medications, they might be $5,000, $10,000, or $15,000 per month per fill. So it's actually not a really bad deal. But if you look at her HSA, she's got a deductible of $3,500 plus her coinsurance. So when we look at the math in this particular scenario, she's going to pay $1,750 for her. That's the annual cost of her monthly prescription. She's paying her copays every month. $2,100 on the base plan, but all of her prescriptions are going to be subject to her deductible, and she's going to hit her deductible on any one of these medications that I've listed up here at the top and many others. She's going to hit her deductible and her out of pocket in the first 2 months. So she's going to hit her maximum out of pocket. Her employer's giving her $600 a year, just like the other examples. But what you can see here is the HSA is actually the most expensive plan for Emily this year. This is one of the scenarios where the HSA does not win out. If somebody's taking a really expensive medication where they can offset their costs with a copay, they're going to pay more for the insurance, but they're going to pay less for their prescriptions on a monthly basis. And ultimately, in this scenario, because if you just look through these 3 scenarios, the base plan wins out here. So my point in sharing this with you is healthcare and health insurance, the decisions that we make, they're very individualized. Your specific situation needs to be taken into account. Look, I get it. It's super confusing. If you're watching this and you've got questions about how to pick your plan, feel free to send me your benefit guide. Ask me your questions. I'm happy to give you some guidance on how I would look at buying the insurance as an individual. I can help you with you or your family. If you got a question about your company benefits, drop me your benefit guide. Happy to answer any questions that you have. But until next time, hope this helps. Take care.